Bladder cancer is a very common cancer, unbeknownst to a lot of people. It's actually in 2024 marked as the 7th most common cancer in the U.S. It's estimated in 2024 that over 83,000 patients will be diagnosed with bladder cancer. Men have a 3 to 4 times more likely risk of developing bladder cancer than women. And for men, it's actually the 4th most common cancer. The median age of diagnosis is about 73 years. And although cancer is not as common in women, unfortunately, it is diagnosed at more advanced stages, and therefore our women have more aggressive disease when we find it, and worse outcomes, unfortunately. The most common risk factor is smoking. We find that of our bladder cancer patients, smoking accounts for almost 47% of these cases. It really increases your risk. A smoker has about 4 times the risk of developing bladder cancer than a non-smoker. There's other risk factors such as genetics. So if a family has a history of bladder cancer, that increases the individual's risk for ultimately developing it. There are also occupational exposures, occupations such as hairdressers, mechanics, leather workers, from the fumes that can be inhaled. That can also increase your risk too. In terms of ethnicity, there's a slight increase in risk for our Caucasian population, about 2 times over other ethnicities. Caucasians see an increased risk of bladder cancer. The most common symptom of bladder cancer is gross hematuria. We can also find bladder cancer with the presentation of microscopic hematuria, which is blood that's only detected under the microscope in the urine. Other common symptoms could be recurrent urinary tract infections, and we actually see this more in our female population. Our females can be presenting to their general practitioner with, again, a urinary tract after another urinary tract. And then finally, when they get sent to the urologist for further help, and we do our workup, which includes a cystoscopy, which is a small telescope that goes into the urethra and into the bladder, sometimes we do find that the cause of those recurrent urinary tract infections has been a lurking bladder tumor. So the treatment options that we use for bladder cancer are varied and really depend on the stage and what we call grade, or how aggressive the disease is. So we put our bladder cancer patients in 2 general categories: superficial bladder cancer patients, or non-muscle invasive, and muscle invasive bladder cancer. So for our superficial bladder cancer patients, many times the first line of defense is to perform that transurethral resection of bladder tumor, or the scraping or removal of the tumor. Many times that can be all that we need. But if the grade or profile of that tumor is more aggressive, then we do need additional therapies. But often these therapies can be bladder sparing, where we give a medicine into the bladder to coat that bladder lining and treat any residual or microscopic disease. This landscape of intravesical therapies has become very complicated over the past couple of years as new drugs are coming out and new guideline recommendations are present. Because of that, we at Colorado Urology have developed something very unique, which is an internal review process where myself and my physician assistant review all cases of patients who are in need of intravesical therapy to ensure our patients are getting the most up-to-date and guideline-recommended treatments available